Thank you so much for including me in your service today. My name is Dr. Shankar Nesathurai, and I am the Acting Medical Officer of Health at the Windsor-Essex County Health Unit. I'm here to share an important message related to the opioid crisis, which is affecting our region at an alarming rate. There are many people who have died of opioid use or misuse in our community. Opioids are a class of drug that includes codeine, heroin, oxycodone, and fentanyl. These are drugs that can lead to addiction, overdose, and overdose-related deaths. They've become a major public health issue across Canada and in Windsor-Essex. In 2019, 48 people died of opioid overdose in Windsor-Essex County. In 2021, the number jumped to 61 people. Across the province, about 2,500 people are dying of opioid overdoses. Opioid overdoses kill at least 4 times as many people as car crashes. It is really concerning, people dying in the prime of their life. These statistics are not only alarming to me as a public health official or physician, but also as a parent and community member. So, why am I here today to talk to you? Opioids do not discriminate. Opioid-related deaths have affected people in all walks of life and of all faiths. Mothers, fathers, sons, daughters, adolescents, young, and the middle-aged. For this reason, we're reaching out to all faith-based institutions, churches, synagogues, mosques, in an effort to spread this important message. Opioids have many effects on the body. Opioids affect the part of your brain that controls your breathing. When a person overdoses, the breathing slows or stops, which can lead to unconsciousness and at times even death. Imagine if there's something that you could do to prevent an overdose death. In fact, there is something you can do. You can administer a naloxone nasal spray to someone who's experiencing an overdose. It's easy to use and it's safe. In fact, it's similar to administering a nasal spray, which you've likely used to treat a common cold. Naloxone nasal spray delivers a fast-acting drug that temporarily reverses the effects of an opioid overdose. Let me demonstrate how easy it is to use. The fact of the matter is that most people do not have to die of an opioid overdose. Many people who died took the drugs at home. Some people do die alone on the street, in an abandoned house, or in an alley. But many times the overdose happens at the residence where some people are living and could potentially intervene. This is one situation where your actions might save a life. How can you make the situation better? At the end of this service, you will have an opportunity to take a Naloxone Kit home for you and your family. If there's anyone in your household who might be using opioids, please take a kit. Even if you're uncomfortable taking one today, please consider obtaining a kit at a later time. You can get a kit from a participating pharmacy or by contacting the staff at the public health unit. Each kit contains instructions. You can also visit the Windsor-Essex County Health Unit's YouTube channel for an instructional video. While I hope no one has to make use of the kit, it's always better to be prepared. Thank you again for inviting me to speak today.